Italy was the first European country to ban flights from China, but that didn't stop the virus from spreading across the region. CBS News foreign correspondent Charlie D'Agata joins us now from Rome. So, Charlie, what is the government doing to slow down the spread?
Well, Vlad, first of all, whatever they're doing isn't enough because we've seen this huge leap over the past 24 hours. The numbers now stand at 3,900, nearly 3,900 people, 3,900 cases, 148 people have died. And those are the largest surges that we've seen since this outbreak began. Now, behind me, we're at the the most important hospital when it comes to infectious diseases. And you can see, you may be able to see just in the background, those silver tents, right? So that is where they've set up a triage where they can have patients who suspect that they may be suffering from this virus. And there you'll see them standing up there. We spoke to them earlier. They're worried, so they go into a triage area. So if they are infected with the virus, they're not going to spread that contagion to the rest of the hospital. Now, this is just here in Rome. It's now everywhere in Italy. Where you will see it most, these triage tents, are up in the north. They're everywhere. And again, this is one of the things that they're doing among several extreme measures. What might be considered extreme. They've closed down all the schools and universities across the country. They're actually telling Italians to keep 3 feet away from one another, which of course is kind of culturally sensitive in a place where they're known to, express their affection to one another. No more hugging, no more kissing, no more big crowds, big sporting events here, like the soccer stadiums. The events are still taking place, but they're taking place behind closed doors. So there are no crowds. And now imagine if that were happening to like the NFL or any basketball games. That's how intense the situation is here in terms of trying to do whatever they can to mitigate the spread of this virus.
Yeah, it's so interesting watching that group that has gathered behind you. I think it's about 6 people. They're all talking very close to each other, all of them wearing masks. Did you notice that? Yeah. So the Vatican just reported its first case of the coronavirus inside the walls of the Vatican. What can you tell us about that?
Well, that's huge. It's potentially huge. First of all, we have our independent confirmation that that's true. The information is correct and accurate. It's concerning for a couple of reasons. First of all, in any sort of confined environment, the reason that you have schools, Iran's prisons have been emptied out, that is where you're going to have the transmission or community spread is going to be at its most intense, and that's a huge concern. In addition to that, what does the Vatican now do in terms of protocol? They're following the Italian health minister's advice, the World Health Organization, trying to keep these crowds down. But I think what we're really going to see here is what this means in terms of the papal address, what it means in terms of people congregating. The Pope was seen coughing a couple of days ago, and he had to cancel some events. So this is definitely going to have an impact in terms of what it's meant officially. All we know from the Vatican is it is official that there has been a coronavirus case. What this means in terms of their protocol and what they do in the future, that hasn't been decided yet, or if it has, it hasn't been shared with the public.
So last week, we just showed video and photos of the Pope coughing during his public outings. Vatican says he's suffering from a cold and not the coronavirus. Given that there's now a case in the Vatican, what steps are being taken to protect the Pope during this outbreak? Because, Charlie, as you know, you may have heard that there are also discussions in the United States right now about all three of the men running for president. Including President Trump and Bernie Sanders and Joe Biden. People are starting to wonder because they are in that demo of which most people have been affected severely.
Vulnerable.
He is an elderly gentleman, and of course, as soon as the Pope started coughing, we were here. Everybody says, "Oh my goodness, it's the Pope." He's an old man. He spends lots of time with the public. And indeed, American politicians, they fall into that same sort of group. We were all waiting there. We went to the Angelus on Sunday to see, first of all, if he was going to show up. He did. He had to stop to cough a couple of times. The Vatican has been very clear. He is suffering from a pretty bad cold, not the coronavirus. But having said that, he decided not to go on this annual retreat on Sunday, which is kind of a big deal. I mean, obviously, I guess everything's a big deal when you're the Pope, but this is one of the things that he normally would be going to. But yes, in a normal environment, we wouldn't have even been paying attention to something like this. But when you have politicians who are going to these large gatherings and they fall into that sort of vulnerable community, the older elderly set, somebody like the Pope, of course you're going to pay more attention to that. I mean, it doesn't quite feel like Italy is a hotspot, but it is, and it's now expanded all over Italy. Now it's expanded to the Vatican. You know, it would just be ignorant and naive to believe that certain people are going to be immune to that. The elderly population is the most vulnerable group, and that is what we've seen here in terms of the numbers. Almost everybody who's actually the victims of this anyway, or the people that are in intensive care, are almost all elderly.
And so we're also learning now that the UK reported its first death from the coronavirus on Thursday. Are European leaders working together to combat the spread between countries?
Well, could the coronavirus be the one thing that unifies Europe? Maybe.
Yeah.
There have certainly been calls in Italy that more must be done. There are concerns, and I have to tell you, from being here for the past week or so and living in the UK. When you start hearing about these cases that are popping up, we know community spread. I know that's a discussion that's happening in the United States. It's happening in individual countries now. But there's so much blame happening in Italy. The Brits have been saying, oh, the people that have got this in the UK, they came from Italy. The Germans are saying the people that got this in Germany, they came from Italy. Well, now it's starting to have this community spread, and it's happening within these own countries. And yes, this is absolutely a priority, not just in terms of people speaking to one another and the movement between countries, but what can be done. I mean, there are even delivery people, like truck drivers, are saying, yeah, I'm not really happy with going to Italy, and others that are saying we're not really happy with deliveries that are coming from Italy, much as we saw in China. So yes, certainly something has to move forward, and Italian health minister is here saying this is a pan-European problem now.
All right, Charlie, thank you very much.